My name is Ali Ahmed Naryoush. I am from Iraqi country.
This patient of ours, Ali Ahmed Mayoush, he came from Iraq. His story was very peculiar. 20 years ago, when the war was going on between the US and Iraq, he was basically an engineer in the army, and he was shot in the face, point blank. This resulted in a horrific damage to the socket of his left eye. He was extremely lucky that his eye escaped and his vision was still preserved. But his tear sac, the tear duct sac, was completely damaged. His floor of the eye was completely damaged. His left side of the facial nerve was actually damaged because of the gunshot, and because of which he could not smile.
Before I was many problems in my face, my eyes and my joke and my smile. When I doing surgery now, Dr. Sunil, I better more than for my smile and repaired my holding eye, and I feeling more better.
In order to make a perfect plan, what we did is we did a CT scan with thin slices, and we got an accurate anatomical 3D printed model of his face. Now this is a very delicate operation because this guy has good vision. The problem he has is with the movement of the eye and the way the eye is sighted inside the socket. So we have to be extremely careful that we don't lose his vision, because when you're actually dissecting in this plane, it can bleed sometimes quite a lot, and if it bleeds too much, it can even impact his optic nerve in the vision. The corner of the eye was totally misplaced, and that's the reason why the symmetry of the eye was not the same. And for this, we use a very special type of titanium anchor. It is basically called a bone anchor, or a MITEC bone anchor, where we actually drill a hole in the bone on the inside of the eye fissure, and we reattach the corner of the eye to this to get a good symmetry. This is a very specialized technique. It has to be performed with accurate precision because you only get one go. Once you drill a hole, it has to be accurate. The anchor, once it goes inside, it opens up and catches onto the bone, and there is a stitch which is actually with the anchor, which can be used to anchor the corner of the eye.
Before surgery, I feeling I cannot repair all this situation to my face, but after surgery, I feeling better, more better.
And the bone graft was then crafted on top of the 3D model, and that was actually then inserted accurately and plated with titanium plates and screws. As well, in the lower lip, essentially when he was smiling, the lower lip was actually going upwards because of the muscle which depresses the lip not functioning well. So we borrowed a tiny muscle called digastric from the neck, and we transferred on to the lower lip. Now it's been only about a week since his surgery, so he still has some residual swelling, which you can see. But patient is extremely happy because the tears have stopped flowing. He basically can see well. He can move his eyes in all directions. He doesn't get double vision. He feels much better when he smiles because he's got a good symmetry. So I think first time in 20 years, he's actually feeling very light. He's extremely happy. He's very hopeful that he's going to lead a normal life after that. I think it's all about getting his dignity and confidence back. I think that's the real purpose of what we have done. 6 hours of long surgery, essentially, if at the end of the day it results in patients smiling and saying a thumbs up, I think it says a lot about what we've done for him. Needless to say that this is not done by a single person. I have a great team. I have 3 consultants, Dr. Pratik Arora, Dr. Raghav Mantri, Dr. Soumya. We have a fantastic anesthetic team of Dr. Fotedar and Dr. Raj Tobin. Essentially, as I said, it's all a teamwork. Working in a multidisciplinary setup in Max Healthcare, it allows us to actually perform these complex surgeries with ease, with comfort, and we are well prepared for any eventualities as well. I think this case really challenged somebody has experienced me as well, and I think at the end of the day I feel satisfied that everything we planned meticulously, including the kind of delineation of all his problems, the various solutions that we actually put down on the paper, we were able to execute them one by one with great detail, great accuracy, and I think at the end of the day, we have a happy patient.
"3D printing has allowed us unimaginable precision in this particular case.
With the newer plastic surgery techniques, plastic surgeons are now at the cutting edge.
Thank you to Dr. Sunil and Max Hospital.